Hello, everyone, and welcome. My name is Janet McLaughlin. I'm a professor of community health at Wilfrid Laurier University and co-director of the Laurier Autism Research Consortium. I'm also the proud mom of a 10-year-old boy on the autism spectrum. I'm honored to be able to facilitate today's very important discussion with this group of esteemed panelists on addressing disparities and achieving equity in a national autism strategy. Unfortunately, equity is far from a reality for many populations in Canada. We know that, for example, girls and non-binary individuals, as well as Indigenous, poor, racialized, and rural and remote populations, face multiple barriers to timely services, from diagnosis to therapy, and these can have profound effects on both short and long-term outcomes. When considering how best to devise a national autism strategy, we must maintain a focus on ensuring that these disparities are considered and addressed, and we should make every effort possible to promote a more equitable future. That's what today's panel is all about. I'd like to start off our discussion by offering the World Health Organization's definition of health equity, which is the absence of avoidable, unfair, or remediable differences among groups of people, whether these groups are defined socially, economically, demographically, or geographically, or by other means of stratification. Equity implies that ideally, everyone should have a fair opportunity to attain their full potential, and that no one should be disadvantaged from achieving this potential. Today, I'll be asking our panelists a set of questions considering this definition in relation to autism services and outcomes and a future national autism strategy. As I ask each question, the panelists will briefly introduce themselves and their organization, and then we'll have a minute to answer. You can read more about them in their attached bios. At the end of this, we'll hopefully have some time left for interactive exchange. If you have additional questions for the panelists as you watch, please feel free to add them in the chat. So our first question is, what are the main challenges you see if talking about current services, or that you envision if talking about a future national autism strategy to achieving equity in your communities? Dr. Shiv Sivapalan, I'd like to start with you. Could you please introduce your organization or community and then answer that question?
Thanks, Janet. I'm a family doctor, but I'm also the director of operations at the SAC Autism Center, which is a charitable organization based out of Toronto that provides service for underserved communities, newcomers, and immigrant families. Initially, our target was the South Asian community, but we have grown and expanded over the last 10 years. Now, that question you brought up was really interesting. When I look at the communities SAC has dealt with, one of our main challenges I see is the lack of outreach. Only recently has there been acknowledgement of the challenges that the South Asian community and more generally newcomer and immigrant families face in achieving equity. I think the lack of outreach leads to a lot of assumptions being made about their service needs and the barriers that they face. And furthermore, as a result of this, these communities themselves are not aware of this inequity. To them, longer wait times, limited access is just the norm. And when it comes specifically to autism-related services, evidence has shown that immigrant and newcomers receive a later diagnosis, which can lead to delayed access to interventions, and then in turn, poorer outcomes. Poverty and cultural perceptions of special needs are just a few factors that play a role in this. And then when you look on a larger scale, on a more macro level, right, one of the challenges is the lack of representation amongst those advocating for services. And although the National Autism Strategy is a good foundation to build off of, I still believe that collaborating with community agencies such as SAC will help develop a more targeted approach that keeps in mind the needs of newcomer and immigrant families.
Thanks so much. Next, we'll go to Bonnie Brayton.
Thank you, Janet. My name is Bonnie Brayton, and I'm the National Executive Director of Dawn Canada. Dawn Canada is a national feminist disability organization celebrating 35 years in service this year. Unfortunately, in terms of girls and women on the autism spectrum, they have largely been underserved, and I'm not saying this from a place of there being a lot to offer in terms of even research in this regard, and Dawn Canada has done fairly extensive research from across disability feminist perspective, and I have to say the information and data and just any focus at all really on women and girls and autism has been very limited. And of course, that's a very big concern. so there's no disaggregated data to tell us the real story here. We know that women with intellectual disabilities, with cognitive disabilities, and mental health issues are overrepresented in a number of disturbing contexts, including in situations such as the homeless population. In prisons, there's a huge overrepresentation of women with those particular types of disabilities. Add race or indigeneity to those, and of course, there's an even higher representation. The same is true in sex work, and like I said, I think a lot of people may be surprised to hear this, but fully 1/3 of sex workers in a study in Canada just a few years ago revealed that they had a long-term disability before they became sex workers. So I think it's important for us to understand that there's an awful lot of places where it's not understood, but in fact, that's the reality. Add to that, Janet, the idea that the highest rates of gender-based violence, in fact, belong to women and girls with disabilities, and you know that among those are young women and girls on the autism spectrum. We do not know what girls and women with autism need or how that changes over the life course from childhood to adolescence to adult and then aging. Inclusive education, including introducing human rights to children early on, is in our view one of the key ways we begin to change the dialogue around equity. And I think, you know, some early research has already shown that when you introduce human rights, not in sort of big language, but really as a principle early on to children, there's really strong evidence that this changes things. And I don't know, there's a lot more to talk about in this area, and I'm really glad we're just starting a conversation because, as I said, Janet, it's a conversation that just is really beginning. So I'm glad we're here to talk about it today. Thank you.
Me too. Thanks, Bonnie. Next, we'll go to Rob Gagnon.
Hi, so I'm Rob Gagnon. I work for the Winnebago Area Health Authority as the organization's public health coordinator, serving the communities of the James and Hudson Bay. And in terms of answering the question posed, the main challenges that I see for the first question is for us within the region, we don't have access to certain services such as regular access to in-person, to behavioralists in person, and even to other autism workers, and in community programming supports, which could include things like respite services, even local events to allow children with autism to have some fun, local support groups for parents, caregivers, and educational workshop opportunities that, you know, others in more urban destinations would have access to. I believe the differences in service access for our region are due to the fact that we are located in a remote and isolated region, and also because the resources available provincially for autism services are sparse, and the burden of providing service falls on a few providers to serve large geographical areas. I believe it would be beneficial for us to have access to local service provision if it were possible, but I am aware that there are not enough providers available provincially to provide targeted services to small populations. This being said, our region does receive service from a team from the Northeastern Ontario region's autism program. They visited our region on a yearly basis to conduct capacity training opportunities with school educators and families and caregiver supports of those who have autistic family members. We also have a dedicated behavioralist that serves our region and who has also made himself available on a regular frequency via phone and virtually to support families and caregivers, but we could always use more where the resources could be identified.
Thanks so much. Finally, we'll go to Neil Belanger.
Thank you, Janet. And before I say a few words, I'd just like to take the time to recognize the traditional territory I'm presenting from today, the Esquimalt and Songhean Nations, and also to recognize the territories of each of the presenters and all the people gathered here today to be part of this panel. So I'm Neil Belanger, and I'm the Executive Director of the British Columbia Aboriginal Network on Disability Society. We provide services in British Columbia and across Canada for Indigenous persons living with disabilities. I think the biggest barrier that we see, the biggest challenge, is the jurisdictional issue. I think that many organizations and governments forget to forget that there is a provincial, territorial, and federal jurisdictions here, and that there's over 650 Inuit and First Nations communities here that fall under federal jurisdiction. So as far as I'm aware, British Columbia is the only provincial government that actually provides services within First Nations communities. And that only happened in 2014, and there's still much work to be done. So what happens is that people have to leave their support systems, they have to leave their communities, they have to leave their families to access services that should be available within their community or in close proximity to it. And that, of course, results in people who have access to services. They're not going for the support. They don't have access to risk assessments, everything comes with it. And then if you couple that with the discrimination, with racism, with poverty, with transportation issues, and all the other myriad of factors that affect Indigenous people in Canada, it makes a very difficult situation where equity, is a great word, but isn't really a reality. We have a lot of work to do. Thank you.
Thanks so much, Neil. So for round two, the question is, what are the main barriers to achieving equity for your communities? And we'll go in the same order, starting with Shiv.
Yeah, like when we look at the families that attend SAC, first and foremost, I think there's just a lack of resources available to these communities. And those that exist typically aren't like culturally sensitive, they contain difficult language or jargon, and they're primarily in English. And this is reflected because of the absence of culturally diverse education and programming for these communities. And a lot of times, these families, they typically feel isolated and won't seek help, mainly because there aren't resources that they can really connect to, right? This is one of our major drivers when we created our CARES program, because it was a response to a lack of a culturally sensitive caregiver support program. Now, when you look at other barriers, and I think like Rob and Neil will probably speak more into this, but geography and socioeconomic variables are also barriers, right? Currently in Toronto, there are a limited number of services in underserved areas. Families typically have to travel a great distance for assessments and interventions, and this can add to their financial burden that some of these families already face, and that's a common complaint for our families at SAC. And I think the most important one is consultations and collaborations with what I call the end users of these services within these communities is not to the level that's needed to determine their needs.
Thanks very much. Over to you, Bonnie.
Thanks. This is a tough one, I have to say. Women and girls with disabilities, including women with the autism, on the autism spectrum, have no champion right now. That's the truth. Certainly not somebody, a woman with autism who's standing with us. I think we know of some, including Greta, right? And there's opportunities ahead for us to think about that and to start showing people that there's lots of really amazing girls on the autism spectrum that are doing all kinds of amazing things. But the reality is that many of these women, in particular women who have been on the spectrum who are adults, have lived a very terrible reality, and something that the feminist community calls the mad women phenomena. And of course, many, many women on the autism spectrum have had misdiagnosis. And although there's limited research, we know that that misdiagnosis has had devastating effects on many, many women, including being misdiagnosed and institutionalized, placed on medication, electric shock treatment, forced sterilization. This is anecdotal at this point, but it points to the fact that we urgently need to do research with women on the spectrum. We need to understand better what their experiences were. We need to start thinking about prevention so that girls and young women with autism now don't have to go through those experiences again. We need much stronger advocacy for that girl, for that woman than has happened up to now, because we don't speak about her. It's almost as if she doesn't exist. And not, I would say, because the autism community wants it that way, but because the medical community has left it that way for a long time, and so has research. So I don't think there's any question, what this is about in the future is partnerships that move us across those intersectional questions and begin to better understand that. In terms of what's missing, access to shelters, access to housing, access to healthcare, to childcare, to sexual and reproductive rights. The highest rates of gender-based violence in a study that was just released last 2 weeks ago from StatsCan confirmed the highest rates of gender-based violence on campuses is young women with disabilities, including young women with autism. Let's be really clear. So, you know, in terms of where we are, we're at ground zero right now as far as I'm concerned, but this leadership summit and these kind of conversations are the kind of things that we need to have happen. And these kind of partnerships are the ones that have to be deepened, including making sure that any academic research that's being rewarded with funding is done properly, disaggregated with an intersectional lens. Thanks.
Thanks so much, Bonnie, for those very sobering reflections. Rob.
Yeah, I think when I look at it from our perspective here within the region that I serve, I think the main barrier for us to achieving equity for communities is again related to, you know, the geography and where our region is located, as we are in a remote, isolated region within the James and Hudson Bay of Greater Northern Ontario. We receive supports virtually and over the phone, but in-person interactions and programming opportunities are limited given our distance. And unfortunately, COVID-19 will also further impact and limit in-person opportunities, unfortunately, for the foreseeable future. But I don't see that changing in our current context, which is unfortunate. I believe, again, the availability of workers in the autism field provincially poses challenges, not just for us here in the region, but overall provincially. And again, our challenges here are exacerbated again by our distance. But availability of resources provincially for autism supports is also scarce from what I've learned. This being said, to advocate for our region, I still strongly feel like we require more in-community supports and in-community resources. Some other barriers to equity include ongoing public education opportunities to help caregivers, families, communities, and schools with the opportunity to be educated and learn about autism and the characteristics of those who have autism. Knowledge of the availability of services in our region unless people seek out supports, and a few reasons that I'll mention that might be. Intergenerational trauma impacts, it could also be one of those barriers, as people are sometimes hesitant to share information with providers they're not familiar with and that they don't see regularly. Language and level of education for certain parents could also be a barrier and pose issues, as some again don't feel comfortable with you know, being able to speak with someone they're not familiar with, not being able to do it in their language, and also being able to do it on terms that aren't jargony and that they can't understand. Also, another thing I would mention is access to getting children assessed, follow-ups, and ongoing supports is also challenging, again, given the resource constraints that I've mentioned before. There's also limitations even around reliable internet, and people even have access to phones in our region. So again, that's something we're really afflicted with. So oftentimes really creative approaches have to be taken to connect with families in our region and for them to receive service. So there's a gambit of different barriers that I'll continue to talk about as we go through the other questions. But you know, I'm here, I'm advocating for our region, and I'm a big believer on what this panel and this summit can achieve.
Thanks so much, Rob. Neil.
Thank you, Janet. I think, and I agree with my colleagues here across the board, but I think to move anything forward within any sectors, we need leadership at the provincial, territorial, and federal government levels and the Indigenous level. In our circumstance, we're lucky now that we have a federal minister that is quite engaged and wants to move things forward. We don't always have that at the provincial or territorial level. Here in BC, we do. Unfortunately, he's not standing up for elections. So that's the first thing. We have to have people in key positions that want to move things forward. We don't have that, disability will not be a priority. We've seen the lack of priority during COVID-19 across the board, although there has been some good announcements of late through the throne speech. Typically, we haven't seen that, you know, in the past moving forward. And we need to step out of our safety zones. We need to work together as a disability community, not just within autism or women with disabilities or newcomers or Indigenous. We have to start supporting each other better to get the pressure on the government and to work together as a community cohesively to move our priorities. But all those other factors that Rob and everyone else have noted, transportation issues, poverty issues, 80% of First Nations in Canada have median income under the poverty line. That's from 2016. Racism, discrimination, and lack of awareness in general about families living, having children and family members with autism and the support that they need. Disability has not been a priority in Canada. We need to raise that if we're going to see significant change. It has been a priority for the Indigenous sector and the non-Indigenous sector, and we've got to make those changes here. Also, from our perspective as an Indigenous organization, we need to see other organizations, disability organizations, embrace the Indigenous side and start hiring more Indigenous persons as frontline workers in senior management positions and at the governance table. So when we look for accessing services, we can't see ourselves in those services, it's another barrier that comes up. So those are all things that every organization, particularly if we're looking at a national strategy, Indigenous side has to be engaged from the get-go, has to be. And if it hasn't been, there's a problem because we can't purport to represent a national strategy or be national or provincial organizations if we've never stepped into an Indigenous community, understand the history and the barriers here. And I think that's the big thing. We have to start learning better and be more active and involved in the lives of those we say we serve.
Thanks, Neil. That's a great transition into the next question. You've all done a great job at laying out many of the challenges faced in your communities. So my next question is, how do you think these barriers and challenges could be overcome in a future national autism strategies? What kind of things do we need to be thinking about? Shiv.
Wow, that's a big question.
Pressure.
No pressure whatsoever. I think, like I was mentioning with the other ones, I think, and it's highlighted with all our speakers today, I think it starts with outreach. We need to work hand in hand with these communities to get a better understanding of what they need and what their biggest challenges are. And I think this will help us inform future strategies. And with that said, though, I think there are a few steps. Neil highlighted this. I think making space for representation on panels, key discussion groups, and strategic planning committees to ensure that everyone's voice is actually heard. I think working with community organizations and specifically cultural liaison to ensure that strategies that are being developed are actually culturally responsive. I also think dedicating resources to create materials in different languages would help with awareness and outreach into these communities. Decentralizing some of these services would help improve access. And adding to what Bonnie had said, promoting community-based research for Black, Indigenous, and people of color, as well as women, I think that's essential. I think we make a lot of assumptions on what's needed and what's happening, but having some evidence to back it up really would help us support any initiatives going forward. And then personally for me, being part of the healthcare sector, and this is something like I really wish would happen, it'd be great to see physicians, residents, social workers, and healthcare professionals that are in training have the opportunity to work in culturally specific community organizations. That's something that I rarely see. I see it starting to creep up and happen with social work internships, but I think it can definitely expand out more.
Agreed. Thanks so much. Bonnie.
Thank you. Boy, this is getting good. I just build, eh, darn it.
Yeah.
So I was going to say, I don't want to repeat really what Shiv just said, but I do think, like I said, I had at the top of my list, inclusive and intersectional research, including storytelling. Because storytelling is one of the ways all of us can reach the audience that is not us navel gazing at each other, because we all have a lot of empathy for each other and we understand each other. But when we start to tell our story and we can have other people connect to our stories, I think it makes a difference. So one of the things that I'm proposing all of us need to start doing is creating what I like to call living libraries, right? Where we have videos and first-person stories from people when they're comfortable sharing them, of course, right? About their experiences, because it helps other people understand. And helping policymakers and politicians and all the decision makers understand what we need is really, I think, at the core of all of this. We need to think about participatory research design that includes girls and women with autism. What do they want? Not us deciding, what do they want? Let them tell us what they need. Defining it for them is ludicrous. Instead, let's have a conversation and start with the person who we're thinking about. I think creating stronger ties between other organizations that have similar challenges is a good strategy. And I think also a way of the shared collective capacity thing can actually be very meaningful if you do really trust each other and work together. I've certainly seen a lot in the women's sector in terms of some of the partnerships we've had with other organizations that were like us struggling, where together we were able to put together some really interesting projects, and they got funded because the funder was able to see the strengths of the different groups working together. So deeper partnerships across all sectors. Now, Dawn Canada doesn't work in just the disability sector. We work in the women's sector. We work in the social justice sector. We work directly with some Indigenous organizations. And so I would say, you know, the human rights sector, if you will, because there is sectors to all of the work that we do. I also really encourage folks in the autism community to do more of these kind of activities, to work across other sectors. And it's not so much the public panels, but I think about, this is a really important discussion that I've never had. You know, and while I think this conversation is important, I'm going to say to Jonathan when he looks at this and remind him, right, that it's about how we move forward with these things. What's our next step? Some of it is almost certainly going to be to do some work together to start these processes. So this conversation is the beginning of something else for sure. I also think that something that was touched on that I think is very important is we really have to get at curriculum in post-secondary institutions. We have to address social work schools, we have to address law schools, we have to address medical schools, including doctors, nurses, all types of specialists, because all of them have terrible, terrible ideas because they don't get taught anything about us. And that's a really, really basic problem we have, is that the curriculum is decades behind where we are today.
Thank you, Bonnie. You're all hereby invited to speak in my class this upcoming year. Would love to have you. I completely agree. Next, Rob, over to you.
Yeah, I think for some of the proposed solutions I have, and again, it's kind of a little bit more of a somewhat localized view that I offer, but holistic once I go through it. I think an allocation of resources enabling for us and for other Indigenous communities to have in-community behavioralists and autism support workers to serve our respective regions would be advisable, along with offering some local workshops and learning opportunities to really provide some supports in the grassroots and on the ground within our communities. Online teleconference or virtual support groups for families/caregivers, along with respite service opportunities within the communities, would help manage caregiver burnout, which I think is something that is really important to consider. More regular communication supports between the Ontario Autism Program, community healthcare providers, First Nation band service providers, and families, caregivers in need, along with incorporating schools in the mix, social work organizations, and ancillary service provider organizations, to ensure everyone is aware of the opportunities currently available for Autism Ontario supports and future opportunities that are out there. I also think a more regular frequency for assessments and coordinated and timely follow-up is needed, along with the leveraging of virtual and clinic space infrastructure for local healthcare and childcare service organizations to allow for families to have the opportunity to participate in autism educational and other support initiatives. I know at WAHA, Winnebago Health Authority in short, we actually helped with NeoKids launch the first ever FASD clinic within our region just a few years ago, and they did it leveraging our resources that we had available within our organization. So some of the things that I just mentioned I think are foundationally important, but I think most important to anything of this is no matter what we talk about, the conversations need to turn into action, and they needed to turn into implementation plans. It's where the rubber hits the road. That's where the work is done, is not only to talk about it, but to also have a coordinated strategy of how to make it happen. So I think no matter how many of these conversations we have, if there's no movement towards getting this towards implementation, you know, we're going to be lost. So these conversations are important, but at the end of it, vitally, there needs to be an implementation plan and a real buy-in at the national and provincial levels to make this all happen.
Thanks, Rob. Yeah, I'm definitely hearing a common theme here that we have to move beyond talking and move into action. So hopefully we'll be able to spur that inspiration today. Neil, we'll finish off with you.
Thanks, Janet. And you know, it's great to go last because everybody gives all the answers. So I'll just say, yep, that's exactly what they said.
Ditto.
So, I agree with everything, and the education component is critical. We work with social workers and nursing students here. We try to work with them to incorporate a disability lens in what they do in the future operations, the work that they'll do. But we have to understand that as well, that anything we do is going to cost money, and it's not going to be, you know, a bargain deal. I mean, disability is expensive, and we need to have the support of governments. And federal government is great, but provincial and territorial government is where things are going to happen. They have to be at the table. They have to be prepared to step up, and that comes back again to who do we have in leadership positions, and what is their priority for disability. And again, we have to be curious as organizations and as a sector to reach out together to look at the barriers that we are facing in our communities, our organizations. Assist families in accessing services and make a plan going forward. But we can't make that plan. I don't think we're ready yet for that plan until we have properly engaged the broader community. And even though I know that the national strategy is kind of focused on the federal side, provincial and territorial regions have a big part to play. And we can't move forward unless we understand from an Indigenous perspective some of the things that are happening right now, and that's reconciliation, it's UNDRIP, and it's the Accessible Canada Act, and what that means for First Nations communities and what it doesn't mean. So without that knowledge and without that curiosity, we will never have, and it doesn't have to be within autism, it can't be employment or housing or poverty. These national strategies, if we don't have an understanding of the sectors that we're working in and that curiosity to understand it and understand it well, it will never be a truly national strategy.
Great, thank you. Our final question, and we are running low on time, so I'll ask everyone to try to keep to their minute, is how can the broader autism community be effective and respectful allies in supporting equity for your communities? Shiv, we'll start with you again.
I think it starts with the broader autism community as a whole, educating themselves and improving their own cultural knowledge and awareness of everyone that's in that community. I think it's essential if we want to improve our own cultural competency and also understand our own inherent biases. I can tell you that just from these questions, if forced, I wouldn't say forced, but it made the our board have that discussion within our own agency to kind of go over are we doing things, and it was a great discussion point because it did lead to change. I think another strategy is to ensure that community leaders are working directly with service agencies to ensure that practices are reflective of the communities they serve. This can help ensure that services providers are welcoming and inviting to everyone in their community. And this direct collaboration, I think, between community leaders and service providers can also ensure that staff and volunteers at these agencies are representative of the clients that they serve. And I think there also needs to be a focus, and I think Bonnie highlighted this, developing strategies that foster collaborations between communities so that there's a better understanding cross-culturally. And I like that living library idea because there are some shared experiences between communities, and having these collaborations may help with developing more long-term strategies that can help multiple communities and solutions rather than just stopgap solutions.
Great, thanks very much. Bonnie. Bonnie, I think you're still muted, but whatever you're saying, I'm sure is very interesting. There you go.
I said I really like following Shiv. Thanks, Shiv. It's always nice to segue after him. So I would say there is no us and them in supporting equity, and there can't be. If you're talking about equity, the us and them thing has to go away from our thinking. Equity means all of us working together and respects capacity as a key lever that the whole of our community needs, because the capacity issues are very real. You know, Neil talked about money before. Dawn Canada, when I started in 2008, had $60,000 a year budget, and I was by myself in the basement of a feminist collective. You know, we're a lot bigger now and all of that, but I've never lost sight of that. And every time I think about our success, I think who's waiting for us to support them? And our whole community has to think that way. The autism community is not well connected to other communities right now. I'm being honest when I say that, because it's like we haven't had any conversations like this before, and we should have by now. And I'm not saying I don't hold some responsibility, but as a national cross disability organization, it's hard because I've got to hold all of that together. So I think it's really important for the autism community to understand it's not that other organizations like mine or Neil's or some of the other folks don't want to work with the autism community, but there has to be some understanding that this is a relationship that has to be built, and that it doesn't happen just because you want it to. You've got to put the time in. There was some real upward movement in the autism movement, and a lot of press and stuff a while back, but it feels like people have allowed that to slip away from their minds, and I think we have to keep that message and you know, the understanding and caring for folks in the autism community really present for everyone. It's the autism community is part of something bigger, and we need critical mass, and we cannot achieve that unless we can bring all rights holders into one space. So what I say is intersectional human rights is the way forward, because intersectional human rights is the way we're all going to hold that space together. Thank you.
Thank you. Agreed completely. Rob.
I think from my perspective, having autism service providers in the broader community as a whole to receive education on Indigenous culture and language, along with identifying effective and respectful engagement practices, would be helpful. If the providers in the broader autism community also come to understand the barriers to participation that provide unique challenges faced by Indigenous people for accessing equitable autism care supports, the understanding of all of this will open new doors to identifying how Indigenous populations could more effectively be informed, engaged, and also how to eliminate the barriers to participation faced, again, by Indigenous populations. I also think, again, more staffing resources and localized supports for autism services and supports within the communities, excuse me, and through telephone and virtual-based opportunities, that will allow this to become more full scale.
Thank you. And finally, Neil.
Thanks, Janet. And I won't reiterate what everybody else has said, but certainly that the outreach by organizations and communities to each other is a big thing as we move forward. You know, and again, reflective of yourself as an organization, how you work with other organizations, how we work together as a disability community. And I had something on my mind, I forgot it now. But anyways, the collaboration and the reaching out, we're lucky that we do have a relationship with CASA. But we're not the only organization CASA should be reached out to, because we're an Indigenous disability organization. There's communities and there's leadership and there's other organizations as well that are stakeholders, and we have to do a better job of that. Thank you.
Thank you. So great. That brings our formal question and answer period to an end. Thanks for that very stimulating and important discussion. I know I learned a lot, and I'm sure everyone listening did too. At this point, I'd like to open it up and see if any of the panelists has any final comments or questions for each other, or further reflections that they'd like to add. Perhaps did anything strike you while listening to the discussion regarding overlaps or differences in your various experiences? Or is there anything else you'd like the audience to know? We only have a couple minutes left, but I'll just leave that there in case there's anything else anyone would like to pose or add.
I'm just going to jump in. I just want to touch on something. Just because that shared experiences piece is something huge that we at SAC have kind of like learned to, jump off of, because what ended up happening is when we did our CARES program, we initially was catered towards the South Asian families there. And as we developed it, we were thinking, okay, will this ever outreach to other communities? And then we started to just promote it to everyone. Anyone could access this program. And then we started to realize like it worked for families in Sudbury. It helped families in Peterborough, in Hamilton, like all over, of different nationalities, different that spoke different languages. And it was all about the shared experiences, and these common shared experiences can really unite communities together and help bring about that change that we're all looking for. And I just wanted to highlight that because I think that's such an important part.
I agree completely. It's interesting to me although we are talking about such diverse communities, how many similar themes and challenges that we've heard. And they may manifest themselves in different ways, but the outcome is the same, that people are facing these barriers to access. Anyone else want to weigh in or add a final thought?
It's Rob Gagnon here. I just wanted to mention that while this is a tremendous opportunity, and thank you for allowing me to be part of it, I do think that we need to have more of this collaboration happen on a more consistent basis. So this is an excellent kind of one-off opportunity to launch a discussion on a very important topic from varying perspectives. And I think our hearts are all in the same place to get more for all those who require autism service supports. The one thing I would like to see come of this is that we have more provincial, regional, working group type arrangements so we can continue this discussion and continue to work on things rather than talking about it once and trying to develop a plan based on feedback that's been shared as a result of one intervention. So I think that's important, is that we use this as momentum to develop a more far-reaching solution around having committees and working groups to continue the discussion and continue the work to get this to implementation.
Great point. Bonnie, did you want to add something?
Well, I first and foremost wanted to thank the organizers for putting this together, because like I said, it's a conversation that I've been wanting to be part of for a long time. And it's a challenge, like I said, when you're cross disability, to be able to get into conversations like this. But I have to say that I think a lot about women, girls, and non-binary folks from the autism community a lot, and have a lot of concern for the fact that in the work that I do and in the research that we do and a lot of the policy work that we do, that I don't have enough to say. And so I certainly want to be able to say and support women and girls and non-binary people from the autism community more. So I do hope more than just this summit comes forward, and that there is a lot more forward, and that Dawn is really looking forward to that. Thank you.
Thank you, Bonnie. Neil, you haven't had a chance. Is there anything final you'd like to add?
I just want to say thank you for the opportunity to participate here, and to my fellow panelists here, and to say that, you know, it's going to take time. National strategies generally do, and there will be ups and downs, but it's as long as we're moving forward, let's keep moving forward, and hopefully we'll get. Thank you.
Great. Thank you. Well, that was perfectly timed, because that brings us to the end of the session. I want to thank all of our panelists today for their incredibly insightful contributions. And I do hope that this is one step forward in a much larger journey towards really working towards equity across all communities in Canada in a future national autism strategy and beyond. So thanks very much for the opportunity to share our thoughts today. And thank you for inviting me to facilitate.